There are a few key strategies to remember when you're injecting substances. First, make sure you wash your hands or use hand sanitizer before preparing your substance for injection. Second, make sure to thoroughly clean the area where you intend to inject with an alcohol swab or soap and water. Third, use a new needle for every injection, but if that is not possible, make sure to clean your needle and syringe with a solution of water and a little bit of bleach before injecting. Fourth, use a clean water source to mix your drugs, ideally sterile water in these packages that you can get at a syringe service program. Make sure that you use a sterile cooker. You can also get these at syringe service programs to mix your drugs, and don't share a cooker or needles or syringes with others. Finally, avoid licking your needle or your skin before or after injection. Make sure to cover any open wounds. This is not an exhaustive list, and we know this is sometimes not possible to always do these, but it can definitely help prevent serious infections like endocarditis. If you develop an abscess or another skin wound that won't heal, please seek medical advice. Thanks for utilizing all these harm reduction strategies to prevent infections like endocarditis.
Infective endocarditis is an infection that involves the lining of the heart, most commonly affecting the heart valves. When bacteria travel through the bloodstream, they can settle on the heart valves and create pockets of infection called vegetations. Valves that are abnormal from birth, artificial or prosthetic valves, and those that have been damaged from prior infection or rheumatic fever are more likely to become infected. It is thought that repeated, ongoing injection of substances can cause damage to the tricuspid valve, which is the first valve encountered as blood returns to the heart. There are several ways that injecting drugs can lead to endocarditis. First, if the skin is not cleaned well prior to injection, the bacteria that are normally present on the skin surface can get into the bloodstream and grow freely. Unclean needles, often the result of reuse, will allow for injection of bacteria into the bloodstream. The practice of licking needles prior to injection coats the needle with bacteria from the mouth, which are then injected along with the drugs. These bacteria are common causes of endocarditis. The liquids used to dissolve drugs prior to injection may be contaminated with bacteria as well.
When bacteria from injection get into the bloodstream, they can travel to the heart and attach to one of the 4 heart valves. When this happens, the bacteria can grow into an infectious mass called a vegetation. Small vegetations may not affect heart function at all, but larger vegetations can impair the ability of blood to flow through the heart, leading to heart failure or an inability of the heart to circulate blood properly throughout the body. Larger vegetations can also break off the heart valves and travel to other parts of the body, most dangerously to the brain, where they can cause strokes. Sometimes endocarditis can also invade the tissue around the valves and interfere with the electrical conduction that prompts the heart to beat, which can require a pacemaker. Cardiologists use an ultrasound test called an echocardiogram to look for evidence of endocarditis, and if a vegetation is seen, we can measure its size and evaluate whether it is significantly affecting blood flow through the heart.
If you are concerned you may have infective endocarditis, you should seek immediate medical attention. Concerning symptoms of infective endocarditis include fatigue, fever, difficulty catching your breath, chest pain, swelling in your limbs, and a rash on your fingertips or toes. Evaluation requires blood work and an ultrasound of the heart. If left untreated, infective endocarditis can cause worsening infection, serious disability, or death. It is important to get treatment quickly.
Treatment of endocarditis may involve surgery, but typically requires a long course of antibiotics, usually 4 to 6 weeks. Most often, the antibiotics are given intravenously. Giving antibiotics intravenously for that length of time may require the placement of an IV line called a catheter. IV antibiotics need to be closely monitored to make sure individuals are not having any side effects, and this is typically done in a hospital, skilled nursing facility, or via a home visiting nurse.
Infective endocarditis is a serious infection that can involve any of the heart valves and can severely damage heart function. The bacteria form so-called vegetation on the valves that can destroy tissue and cause valve leakage. Indications for heart surgery include large vegetation that are high risk of traveling to other parts of the body or form destructive abscesses, vegetation of the heart valves, such as the aortic and the mitral valve, infection that causes the valves not to function properly, and infection that will not improve without removal of the vegetation. Surgery for infective endocarditis involves a patient needing to be on the heart-lung machine and typically requires sternotomy, where the heart surgeon makes an incision in the middle of the person's chest to remove the infection from the heart valve. Sometimes minimally invasive techniques can be used. Most often, the valve needs to be replaced with either a mechanical or biological valve, although sometimes the valve can be repaired. Surgery for infective endocarditis typically take 4 to 6 hours, but can take longer time in cases where reoperation or when multiple valves are involved. It usually takes patients several weeks to recover from surgery, and typically this also includes several weeks of intravenous antibiotics. Operations for endocarditis are usually intermediate to high risk, although here at Yale, being a high-volume center for endocarditis surgeries, our outcomes are quite good compared to other centers.
There are currently 3 medications available to treat opioid use disorder. Methadone and buprenorphine are highly effective at preventing overdoses, risk of death, and cravings, and extended-release naltrexone can be a good choice for some people. The first medication is methadone, which is a full opioid agonist, which means it fully activates the opioid receptor. This medication can be administered at hospitals and opioid treatment programs. We have over 50 years of evidence to show how effective it is to treat opioid use disorder or opioid addiction. The second is buprenorphine, which is a partial opioid agonist. What this means is that it partially activates the opioid receptors. This medicine can come in a film or tablet that dissolves under the tongue or in a monthly subcutaneous injection. This medication can be prescribed in hospitals, addiction treatment centers, and other outpatient settings. The third medication is a monthly injection called extended-release naltrexone that is an injection administered in the upper buttock, and this is an opioid antagonist. What this means is that this medication blocks the effects of opioids. This medication must be taken monthly to remain effective and can be administered at hospitals and outpatient settings, and an individual must be completely off opioids before this medication can be initiated. So please talk to your clinician about which treatment option may be best for you and have an open conversation about your goals.
At Yale New Haven Hospital, we have developed a multidisciplinary team of addiction medicine specialists, cardiologists, cardiac surgeons, infectious disease specialists, hospitalists, social workers, case managers, and other specialties as needed to ensure that all patients with injection-related infective endocarditis are getting the best medical and surgical care possible. When individuals have addiction, we work to make sure they are being offered essential treatments. Our dedicated team meets together on a regular basis to review patient cases and improve our processes. Once you have infective endocarditis, you are at a much greater risk to get it again, particularly if you have a new valve placed in your heart. It's important you are doing your best to avoid future injection drug use, if possible, and consider safer routes of substance use. If you do continue to use injection drugs, it's important to try to be as clean as possible while you are injecting. This makes hand washing, washing your injection site, using new needles each time you inject, and avoiding practices like licking your needles or your injection sites very important. Treatment with medications can dramatically help you cut down on your use of substances or stop using substances altogether. It's also important that you are following up with your clinicians, such as your infectious disease clinician, cardiologist, surgeon, and addiction medicine clinician. The other important thing to do is take care of your teeth, which can be a source of infection, so get regular cleanings, floss, and brush your teeth regularly. After completing the recommended course of antibiotic treatment for your endocarditis, talk to your medical team about how to prevent future cases of endocarditis.